Why did a 47-year-old die at an IV bar in Texas this summer?
Was it preventable?
What could go wrong at IV bars? A lot. Stay tuned. This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. In today's episode, we are taking a deep dive into IV bars. In July 2023, a 47-year-old mother of four died within minutes of being treated at a medical spa in Texas. What happened to her and why? What you should know about IV therapy and how to avoid this deadly fate. Dr. Judy Rubin joins me today to explore the hidden dangers of IV bars. Today, we're talking about IV bars and how IV bars can be deadly. I'm here with Dr. Judy Rubin.
Hello.
All right. Thanks for joining me, Judy.
Anytime.
Awesome. Tell me something about yourself so our listeners can get to know you a little bit.
Well, I'm a third-generation female physician. My mother and my grandmother were physicians, and I am a classically trained family physician who brought aesthetics into my practice about 20 years ago so I could support my habit of being a family doctor.
That's fantastic. Well, thanks so much for being here today. I know you're basically an expert in IVs, and I think that you're the perfect person to have here to discuss this case. So let me tell the story first. One of the main reasons I was starting this podcast is because there was a woman named Jennifer Cleveland this July who's 47 years old, mother of four, and she worked at a radio station in Texas. And she was doing some social media marketing for, I think, a woman who was a friend of hers or she was friendly with. The med spa was called Lux in Wortham, Texas. And she was doing the social media marketing for someone named Amber Johnson. She told friends that she was going for IV therapy at the spa, and she died at the spa in the middle of getting the treatment. So what we know about the case, the spa owner had no medical license at all, no nursing training or anything like that. On her website, it said she was a certified practitioner, whatever that means. She did have a medical director. His name was Michael Gallagher. He's an anesthesiologist who worked in another town in Texas about 106 miles away. The spa was only open for 3 months, and he had only been to the spa location 3 times ever in the history of the spa.
And did the spa owner put the IV into the patient?
Oh, yes. Yeah, Amber. And so when this happened, we heard about it. A bunch of us doctors in aesthetics heard about this. And there was a lot of speculation about how she died because it happened so quickly. A lot of people thought she might have died of an air embolism. Was that your first thought?
No.
What did you think at that time?
I really didn't know. I didn't venture a guess of the reason why the patient had passed away.
Okay. Well, so it turns out that it wasn't an air embolism. It was actually a potassium infusion, which basically, in case you don't know, this is how executions are done.
Yeah. Never give potassium if you're outside of a hospital. Give it really slowly.
I mean, it's not funny, but potassium will stop your heart. Okay. So that's how she died. I was hoping to talk a little bit about IV therapy and why somebody might actually need an IV or want an IV, what the benefits are. And then we'll move on to like what the risks are and what the dangers are.
Sure. I mean, we use IVs for patients in the emergency room, in the office, for all sorts of different conditions. A really popular IV that patients come in and ask for is hydration IV. And we have used IVs for years for people who are pregnant, who can't keep down any food, can't keep down any fluid. It's called hyperemesis gravidarum. In patients who have volume depletion because they have a virus, a stomach virus, people who are just dehydrated for many reasons. And in my IV bar, where I see every patient and I prescribe every IV, we use all sorts of IVs. We have immunity IVs that we used a lot during the beginning of COVID to increase people's immune system function. We give a lot of NAD IVs that help people with chronic diseases. There's vitamin IVs for athletic prep. There's IVs for muscle relaxation. But at the bottom line is that as the physician, I see every patient, I order every IV, I take a history on it.
And in your clinic, who prepares the IVs?
Either me or my RN BSN.
Okay. And then where do you get them from and how do you store them? Do you worry about any of that?
Absolutely. So we get all of our IV fluid from McKesson, and they're a large distributor. And we get our IV components from a 503B compounding pharmacy. So 503B compounding pharmacies are for office use, and you can use the bottle for a month for multiple patients.
Okay, great. So for those of you listening, McKesson is one of the biggest medical supply companies in the country. Most hospitals many hospitals get their supplies through McKesson. So what are the risks of getting an IV? We talked a little bit earlier about air embolus. And air embolus is when a big bolus of air, a big pocket of air gets into the IV. And if a big enough pocket of air gets in there, it can go to the heart, and actually the heart won't be able to pump anymore. It's like getting air in your pipes.
Yeah.
It's pretty rare to get that. You need kind of a lot of air, but you can imagine if you left the IV open and the person took a really deep breath just at the right amount, right time, It could happen. So that's why it's really important to have training when you're putting IVs in.
Oh, there's a lot of other things, though, that complications you can have from IVs. I think the number one would be infection, not knowing how to use sterile technique. Putting a catheter into someone, you can hit a nerve, you can hit an artery, you can hit a tendon. There's lots of structures where we normally put IVs. Also, if you make the IV and it's too concentrated, you can cause irritation to the vein. And if it's not concentrated enough, you can blow up all the red blood cells in the body, and the patient can die from a hypotonic IV, an IV that doesn't have enough concentration.
Right. So for our listeners, again, hypotonic means basically there's not enough salt in the water, and that can explode your cells. So super duper bad for you. And we mentioned potassium earlier. Is there anything else that we missed?
Oh, I think when you're giving IVs to a patient, you have to have the tools in the office to code the patient and to treat any kind of bad side effect that they might have. In terms of potassium, you should always have calcium, you should always have insulin, you should always have glucose. We never give potassium in the office. And if you're giving someone an IV, then you're giving them more volume. You really need to evaluate the patient and make sure you're not going to harm them.
Right. So the bottom line is if you're giving people IVs, you really need to understand not only the patient and any diseases they might have, the condition of their heart, the condition of their kidneys, but also know all about hemodynamics and physiology of blood flow. And those are all things that your average untrained person will not have any idea about, right?
Yeah,
what about if they hang the wrong thing or hang something unusual in an IV? What happens then?
Well, I don't know because I don't hang unusual things, but I do know of one case down in San Diego where a patient was given IV turmeric. And I did look up IV turmeric, and there is mention of giving IV turmeric in England and in Canada. And then they cite studies that were all done orally. But this patient in San Diego was given IV turmeric, and she died of anaphylactic shock in a matter of minutes.
So when I heard about that, it seemed obvious to me that you wouldn't grind up a spice and put it in IV. But you're saying that actually people have experimented with that?
They have.
That is really interesting. So Do you know, is there a reason you would want to take something IV that you could just eat?
Oral turmeric is not well absorbed. And so IV turmeric obviously is 100% absorbed. There is one study that I was able to find in PubMed, which is the National Library of Medicine, where they gave patients IV turmeric who had cancer, and they showed benefit to giving them IV turmeric, but it was in a hospital setting in an infusion center.
Right. So if they did have anaphylaxis, you'd be able to treat it.
Absolutely.
Okay. So we understand now that there's not only all this knowledge, but you also have you have to have the equipment and the wherewithal to take care of emergencies, because when you do have complications with IVs, those happen immediately because you're feeding something directly into someone's vein.
Absolutely. It just takes seconds.
So, so all these considerations are really important before you think about going to get an IV anywhere. Okay. Do you trust the people doing it? Are they knowledgeable? Are they doing it legally is one question, but also are they doing it in a medically sound way and in a safe way? Chances are, if it's a random person or there's no doctor within many miles of the place, they're not. So let's move on to another aspect of this that was really baffling for me. So how is it that this person, Amber Johnson, who did not know what they were doing, could possibly open a med spa in the first place? I mean, there's so much to unpack here. So one of the most important things, and I'm not going to get too much into the weeds about the laws around the corporate practice of medicine, but I want to mention that here. We're going to do a whole episode on this at a later date. But the corporate practice of medicine, or we'll just call it CPOM, is a set of laws that happened about a century ago in the early 1900s. And those laws were set up so that businesses or business people could not dictate to doctors how to treat people. It was really set up to protect patients. And so in the general gist of these laws is that only doctors can own a medical practice. So how is it that this not even any medically anything person could own this med spa? This is what's so kind of upsetting about this entire thing. You know, she's not only doing this illegally from a, practice of medicine thing, but also she illegally owned it in the first place. So are there loopholes to that? Yes. And again, we're going to address this in another episode about the laws around med spas. There is a loophole that a non-medical person can set up an MSO, which is a management service organization. And that MSO can own the spa-like parts of the med spa. So they can own the front desk equipment, and they can hire a receptionist, and they can place orders and use the POS system and all of that. But they can't own the medical practice. The doctor has to own the medical practice, and the money has to go to the doctor. And then the doctor can pay the spa person for doing all the business part. Okay. Now, usually these MSOs are set up so that, and this, again, I'm going to bore you guys with this weird information, but these MSOs are usually set up by lawyers who make it so that the MSO has control of the bank account and the credit cards. And so it's all under the doctor's name, but the MSO, whoever owns it, actually has access and control over the bank accounts and pays the bills. So it looks like the doctor's getting the money, but they're really not. Mm-hmm. Again, is that really, it's sort of quasi-legal, right? It's set up in a way that looks legal, but in practice, if that doctor's never at that med spa, then really there's no supervision, and that's at least unethical, if not illegal. So Amber didn't have a nursing license or any license. So was it legal for her to start IVs? That's another interesting, weird thing about Texas. Are you familiar with this crazy thing about Texas?
Yeah, from what I understand in Texas, as long as a doctor trains you to do something, you can do it if they prescribe it. And you don't have to be a nurse or any type of medical worker. You can put in an IV if you're trained to put in an IV.
Right. That's assuming the doctor is supervising you. But yes, that is totally true. And in Texas, there are many practitioners who are not licensed, who are working under a doctor, who are legally allowed to do various medical procedures as long as the doctor agrees to supervise them to do it. The problem that fell apart here is that this doctor was not doing that. And clearly this person didn't know what they were doing to have hung potassium and killed this poor person. What about scrubs? You mentioned something earlier to me that I thought was really interesting. Yeah. Just wearing scrubs makes people trust you. Is that right?
It's true. I had a patient who came in last week who wanted to get an IV, and I was taking her history, and she said, well, you should just give me whatever IV you feel is correct because you're wearing scrubs, so therefore you know what you're talking about. But as you know, you could buy scrubs anywhere.
Yeah, this might be why I never wear scrubs. Actually, I don't wear scrubs as an aside because I did surgery was my first clinical rotation in medical school. And clearly, listeners, I'm not a surgeon and I really never want to be a surgeon. But to me, scrubs were associated with 10-hour cases where I couldn't use the bathroom or eat. And I just, once I finished my training, I just had no desire to wear scrubs ever again. But just because someone is wearing scrubs does not mean they know what they're doing. It doesn't mean they're a nurse or a doctor. It doesn't mean anything other than they bought some scrubs. Do we know what happened to Amber?
We don't know. We know she cooperated with the investigation. We know they shut down the spa, and we don't know what ultimately happened to Amber.
Yeah, as of this podcast, we could only find reports that she was shut down and was cooperating. We don't really know if she ever had any consequences. I'm not a lawyer, but in my opinion, people like this are practicing medicine illegally to make a buck, and they're risking people's lives. And it's their own negligence that killed this lady, her own ignorance and negligence, and it was reckless behavior. And I don't know what that translates into in the law, maybe manslaughter or something. I'm not a lawyer, people, but
neither am I.
But all I know, it was wrong and egregious.
So do you know what happened to Dr. Gallagher?
That I do know. So his license was temporarily suspended. He couldn't practice medicine for a few months, but then it was reinstated with the one restriction that he can't supervise anybody else, but he can keep practicing medicine. So he's back to being an anesthesiologist at his old hospital. So I'm kind of curious, do you think that any other laws were violated? I mean, we've mentioned so many laws that have been violated at this point.
Well, I don't think the patient had a good faith exam by the doctor. There was no one wrote a prescription for the patient to get the medication. So if you put an IV in someone, that is a medical procedure, and the IV bag, which is fluid, is a medication that has to be prescribed by a doctor, let alone the fact that they added other things to the IV, some of them that were obviously lethal.
Right. So many things were missing here. A good faith exam, for those of us who don't know yet, is what happens when the very first time you see a doctor or a nurse practitioner or a PA in many states. That person has to do an intake, a good faith exam, do an assessment, figure out what's wrong with you, what recommendations are, and prescribe a treatment plan. A nurse can't do that, and anyone lower than a nurse and a medical assistant or random person off the street can't carry out anything that wasn't prescribed by a doctor. So as far as we know, we don't 100% know that Dr. Gallagher did not do some kind of video good faith exam, but we don't believe that he did. Those can be done by video, and a lot of places now outsource the good faith exam. So these are places that don't actually have a doctor or a PA or a nurse practitioner, and they actually outsource to an outside company to do a virtual good faith exam with some, usually these are nurse practitioners. I don't know any doctors who participate in those companies, but for a nominal fee, these outside companies will offer a virtual exam. I don't know how you can address somebody's skin. So we, for the most part in med spas, deal with people's skin. During COVID, I had to do video consultations, and I found it very difficult because I really couldn't evaluate someone's skin over Zoom. Yeah. So I was really happy when we could go back to doing in-person exams. But you should know that although that's legal, it's not really kosher because you can't really make a realistic assessment that way. But that often will substitute for a good faith exam. So what about all those IV bars like in Vegas or Key West where they're basically, you go out for a heavy night of drinking and partying and you go to this IV bar and get hydrated the next day so you can party the next night?
Yeah, I mean, if they have a doctor that is supervising them and doing an exam and writing the prescription and reviewing the patient's history to make sure they're safe, then it's fine. But we've all been in Vegas and walked past the IV bars, and that's not happening.
Right. People feel like they can just order it up like just another martini.
It's on a menu. You can pick what you want off of the menu. But, if you pick the wrong thing or you give a patient who can't handle an IV fluids, they could get into serious trouble.
Exactly. So those IV bars are often using standing orders. That is not actually legal either.
No, it isn't.
Standing orders are when a doctor has an ongoing relationship with a patient and leaves standing orders for that specific patient in case of a change in their status. For instance, if your patient is a diabetic and their glucose comes back too high or too low, you can adjust the insulin. Those are kinds of standing orders that doctors give to nurses to carry out so the nurse doesn't have to call the doctor about every single glucose reading. But in these IV bars, they're using standing orders to apply to everybody who walks in off the street. Now, what's wrong with that?
Well, if you have to assess every patient, every person is an individual.
Right. So you can't just give the same IV to everybody who walks off the street who says, I'm hungover.
Yes. You have to ask them, how is your kidney function? How is your heart function? Do you have edema in your legs? Do you have any lung disease? And then you need to make sure that all of that is true.
Right. And they don't have any other kind of unusual diseases that might interfere with them receiving various hydration packages.
Especially allergies.
And allergies. Big one, big one. So the bottom line is if you go to an IV bar, there are lots of ways to die. On top of that, there are lots of ways that they'll just take your money and you won't really benefit from it. On the other hand, there are some really great benefits to IVs if it's done properly in a medically sound way.
And if you are able to treat the patient for what they need. Sometimes people come into my med spa, which also has an IV bar, and they want an IV to treat a certain disease that an IV is not recommended. It's not going to help them. And I think a physician who's interested in taking care of the patient versus someone who's just interested in putting an IV so they can make money will say, no, that's not going to be to your benefit. And I did that as recently as 2 days ago.
Yeah. So again, if somebody has your best interests at heart, they're not going to give you an IV that you don't need. So thanks so much for coming today. I think we learned a ton about IV bars. It breaks my heart that this woman died in Texas. And if anything we could do that educates everybody out there to know more about it so this doesn't happen to them, that's why we're here.
Absolutely.
Yeah. So thanks so much for being here today.
Thank you.
If you have a question or a crazy story of your own that you'd like to hear on Med Spa Mayhem, contact us through our website, medspaamayhem.com, or check out our contact info in the liner notes. If you learned something and like what we're doing, please give us a 5-star rating. And read the book. Med Spa Mayhem is coming out June 11th, 2024. The link to pre-order will be available very soon on medspaamayhem.com. Judy, thanks so much for joining me today to talk about IV bars. Is there anything you'd like to leave our listeners with?
Yes. I would say always be safe so you're not sorry. Ask the right questions and know who's prescribing the medication and who's putting in your IV.
If you'd like to read more about IV treatments, we've linked to some great information on Judy's website in the liner notes. This has been Med Spa Mayhem with Dr. Kate D. We are so grateful you are listening, and we hope you have learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Med Spa Mayhem comes out June 2024. Available everywhere books are sold, and you can pre-order soon on medspamayhem.com.